Hello, this is Dr. Do again. It's good to see you. We continue with this special edition for the quarantine time. Talk about the metabolic syndrome. Previously, we have talked about the obesity, including this category, as I mentioned before, the hypertension, hyperlipidemia, diabetes, and obesity. So we have finished obesity with the numbers to look at, and also the recommendations of how to lose weight. And today I think I'm going to talk about the hyperlipidemia. What does that mean? What is the hyperlipidemia? What does it do to our body? How to prevent it? And what is the impact for hyperlipidemia? Okay, first of all, hyperlipidemia refers to there are too many lipid tissue in the body. Lipid, there are two kind of different forms. Majority of them is called triglyceride. Triglyceride is where we found in our fat tissue, under the abdomen, or around the organs, or under the skin. So these are the major triglyceride. The good part about this triglyceride, we need it. We have to have it. First of all, it serves as a insulation, okay, to preserve heat, and the cushion around the organs like a kidney or under the skin. So when you fall, you have little a buffering cushion effect, so that's good. And the lipid, the fat, is the major energy source for us. Okay, it comes from food. We intake the food, carbohydrate, and the fat we take, and transferred into the triglyceride deposit there. The other source is the sugar. If we have too much sugar, we ate too much sugar, the body can store the sugar in the form of glycogen. But when that reaches saturation, okay, the body cannot make more glycogen, so those extra sugar will become the fat deposit under the skin or inside of the organ. And there's another class of the lipid, it's called the cholesterol. Okay, they are circulating in the blood or making from the liver. So during the circulation blood, if you imagine there are too many lipid tissue circulating blood, increase the viscosity of the blood, so the blood becomes thick, sticky, okay? And those lipids can deposit on the wall of the blood vessel, form the plaque. And inflammation, the plaque becoming bigger and bigger. Eventually, if this plaque attracting more inflammatory cells, it's kind of a cycle. The lipid, called the cholesterol, the inflammation cells, the inflammation, and more lipid, more cholesterol, more inflammation cells. So from the plaque, bigger and bigger, eventually will block the blood vessel. Either a big one or some of them will be dislodged, means falling off, and then wash away along with the blood vessel. Probably if the vessel is big, it's okay, but after when those small falling of thrombi block the blood vessel, in brain cause the stroke, in heart cause the heart attack, ischemia. Okay, so this is the fundamental knowledge. Probably you know it. I hope I explained clearly. But anyway, hyperlipidemia, it's long run, in terms of long run, it's really bad. So that's involved in the, if you do the annual physical, you get a number of total cholesterol and triglyceride, and the cholesterol total less than 200. There are different forms, low density lipoprotein, LDL, which is the worst one. In addition to triglyceride, the worst one is LDL, and the good one is HDL. What does it do? It cleans the cholesterol in the blood. So you probably know this. Your doctor probably already talked to you. Anyway, so this is what happened if you have hyperlipidemia. Increase the risk of thrombosis, okay, and increase the risk of blood clot, and then causing the block the blood vessel, causing ischemia. How to prevent them? If you don't have it, that's great. Start from early to prevent them. Again, healthy lifestyle, exercise regularly, healthy diet. And you can start from, like I said previously, exercise take different form, especially when you reach 50 years old. I really recommend the long, slow exercise. There's no study, but this is just the physiological explanation. So the short time dynamic or static exercise is fit for the young people. For the older, getting older, is dynamic, slow, long, to sustain, to build up the strength of the heart and maintain this, the sustaining. Okay, and limited sugar intake, because like I said, if you have too much carbohydrates, the body, especially getting older, the liver function all going downward, so cannot synthesize enough glycogen, and the muscle mass is smaller compared to the young people. So that's where the glycogen synthesis happened. So if you take too much sugar after 50 years old, it's really beyond the capacity to handle it. So then they will become lipid. Those extra carbohydrates will become fat, and will around the waist, which is significantly increase the risk of cardiac disease. All right. And there's some medications. You talk to your physician. If your physician will prescribe you some statins and monitor your blood cholesterol, use this medication will decrease if you already have the high cholesterol. Okay, so this is basically give you some idea. I hope it helps. I hope I explain clearly. Basically, start from early exercise, healthy diet, limited carbohydrates, limited fat intake, so then decrease the risk for stroke or cardiac ischemia. So this is the briefly wrap up for today's video, and I see you next time. Thank you for listening.